this was a very lively meeting, and there were very large number of trials presented, and this is really exciting for the field to see high quality research and so many studies being presented at ESOC from actually not only from Europe, but really from all over the world. We had many studies and interesting trials being presented. I think it's very difficult to select some studies since there was so large number of studies being presented, but I guess the TEMPO2 trial was a very interesting study and a bit striking results. So there was no difference between giving tenecteplase or best medical treatment for this antiplatelets for these patients with mild stroke, but still with a perfusion deficit or even a vessel occlusion. So this is something we need to look at, and probably will change practice as well. But of course, we still need the results from the distal occlusion trials and other trials that may help us on the decisions concerning some of these questions. Also, there was the Chinese trial on the tension IA trial. I think, although small, this was also an interesting study, and this a bit opens the field for new trials that are planned on this question of adding tenecteplase or thrombolytics after endovascular treatment to improve recanalization or to improve the no reflow phenomenon and so on. So this is definitely something we will hear about in the next years, and this was kind of a preliminary approach. And I think the switch trial is also a very interesting trial that was presented. So we know from the last ESOC that from the ENRICH ICH trial that lower hematomas, they may benefit from some type of less invasive neurosurgery approach. But for deep bleedings, we always consider whether or not to do decompressive surgery, or at least in some cases, but there was no evidence. So now we do have a trial, although it's not very large. It provides very important information concerning this decision. We can understand it reduces mortality, but also that the number of patients with severe disability is relevant. So, but it informs our decisions, and definitely was a very important trial. And we look forward to have also more results on ICH, which was for some time maybe a neglected topic in the field, and now we see so many new trials being presented on ICH and many positive. So we really look forward to the next years on the field.